Thank you, Deputy Speaker. The Victorian health system in this state, we know, is in quite a state of disrepair. So any more we can do to help our frontline healthcare workers has got to be a positive, right? And this bill, in its concept initially, is good, but it does have flaws. The simple answer is yes, obviously we want to help our frontline workers, but this bill isn't that simple. The base concept of this bill would be great. And our healthcare workers, our AMBOs, our allied health professionals, our clinicians would love to be able to get hold of all sorts of patient information in a snap, and that was pointed out by a member for South West Coast earlier today. In my electorate of 35,500 square kilometres, we have 5 different health services. They include Mildura Base Public Hospital, East Wimmera Health, Mallytrack Health and Community Services, Robinvale District Health Service, and they are supported a great deal by the Royal Flying Doctor Service. In fact, the Royal Flying Doctor Service are about to increase their service delivery to the Robinvale District and held a roundtable there last week, which I attended, and it was fantastic. The robust discussion and debate and ideas to come out of an event like that was truly inspiring, and it's a testament to what can actually occur when you bring everyone to the table with the freedom to tell the truth and work through some of the issues that we know occur, where the gaps are, how they can be filled, and give people the freedom to speak freely. It's an exciting time, and I do congratulate Robinvale District Health Service, Dr Jane Neeland, our beloved doctor, and the Royal Flying Doctor Service on their collaboration efforts so far. We are truly very lucky in Robinvale. This is thinking outside of the box in terms of rural healthcare, and we need much more of it. What we don't need is putting everyone inside the same box. This bill would help to streamline processes across rural health services, and I'm sure having all of the multi-purpose services and sub-regional health services able to share information would be very effective. For example, if an accident occurred on Oyen Lake or on the Murray River, for example, and I would like to offer my sincere condolences to the family and friends of the young man who was the victim of a fatal accident on the river last weekend, on the Murray River. It's something no one ever wants to see occur, obviously. It's an absolute tragedy, and my sincere and heartfelt condolences do go to his family and friends that were there with him at the time. Also, thank you to those first responders, the police, divers and emergency workers who responded to this tragedy over the weekend. You do the work of angels, and words will never be enough, but thank you for your service. Given that now is the busy harvest period, even though safety standards exist and are better than they used to be, although there's still some work to do there as well, farm accidents are always possible, and they do occur because most of the work is still done by humans, mostly. But if an accident occurred on a farm during harvest and the worker is from the city, actually that probably doesn't happen, but you know what I mean, if they're coming in from other parts of the state, access to information from other health services would be very helpful. But what happens when these patients might be from interstate, which for us is literally 2 minutes away, because the border in border communities is used more for recreation than it is for separation. We operate as one. Unfortunately, that river does create 2 states, which is something that member for Benambra pointed out earlier today. Will this database talk to Far West New South Wales Health like we would need it to in the Mildura electorate? No, it won't. And it's only mandated for some specific health services like the ones I've mentioned, the multi-purpose services, the sub-regional health services, but not GPs. Wouldn't that also be very, very helpful? It's a decent concept, but these are the flaws that don't make sense. These are flaws, and they are actually horrendous. If we're going to do this, we need to do it once, and we need to do it well. Over the last 3 years, people of this state have been forced into things they didn't wish to be. It's a fact. They are sick of it. It's a fact. People in my community who are locked down and mandated by the government are sick of being told what to do and being told that they don't have a choice, which is why we need an opt-out clause. This is fact, and I know this because I do in fact spend a lot of time talking to my community. In the last week, I've done almost 2,000 Ks in the car talking to members of my community. I've received emails and phone calls to my office raising concerns about the lack of substantive amendments made to this bill since it lapsed in the last term of government. These are everyday people with a past who are not comfortable with the fact that this scheme is exempt from freedom of information requests. They're concerned that they cannot opt out. They're concerned that their medical past might come back to haunt them, even though it might be well and truly in the past. It's a very real concern. As Member Followin spoke about earlier today, those who may have been victims of sexual assault, may have been hospitalised for mental health issues, etc., in the past and sought treatment, probably don't wish for their records to be available to someone in a health service who's been delegated to have access. If you've sought treatment for mental health, family planning or any of those things spoken about for the member for Lowan, you would like that to be protected. This is a valid concern for all of us, and we need to give Victorians back their freedom of choice. For some, fine, there is no concern. The sharing of medical information in a government database is nothing for them to be concerned about, and that is fine, but there needs to be choice. There might not be anything sketchy in there. Great. Half your luck if you've got nothing sketchy in your past. It's not that way for all of us. Yes. Very medical term. Thank you, Member for Gippsland East. There's also the threat of cybersecurity breaches, which we've seen, and health databases are a target. We've seen it with Medibank. We've seen it with all sorts of cybersecurity, and cybersecurity is one of those things that does, personally, scare me. It's a major concern, and for others, it's just the principle and the fact that they're just sick and tired of being told what to do and of the government overreach. Going back to the hackers, health information, like I said, is something they target. You get health records with Medicare numbers and all of that in there, current addresses, that's enough to steal your identity. You only need to hack one database and you've got enough to steal the identity of hundreds of thousands upon millions of people. We need the choice to opt out. And the government, until we can get an absolute guarantee, which we cannot at the moment, no database can guarantee 100% safety, particularly one that hasn't even been budgeted for, we need to do this properly. It could cost hundreds of millions of dollars, which could build a brand new Mildura hospital that we've outgrown and we so desperately need. Granted, we don't know how much that will cost because we're still waiting on the master plan. There's still work to be done here. There's a lot of work to still be done here, and the best place to start is giving Victorians their choice to opt out, not to be mandated in and for it to be included in FOI requests. That may not create perfection, but it's a good place to start and a way for us to all work together and be constructive on something that actually could be very good here. So whilst the concept of this bill, I agree, is good, it's not perfect. The inability to consider each clause in detail means that it's not as good as it could be. And until the government agrees to listen to all Victorians and allow it to be debated clause by clause, it will not be as good as it could be. I'll say it again, if we are going to do this, we should do it once and do it well. Thank you.